Hello viewers, how are you doing? How have you been? Oh my god, I just couldn't wait to see you all. I want to say thank you so much for welcoming me into your hearts and into your homes. This is our first video and welcome to Afrocliq TV. If you are a new subscriber, welcome to this big family. If you're already a subscriber, thank you and welcome again. And as you know, this is your girl, Mamia. How have you been? How are you doing? How are things going for you? I know you're doing so well. And today being the first video on health issues, we're going to talk about something very interesting. It's something that most women have experienced, some haven't, and for those of us that will experience it, I believe it's fine if we all learn about it. Okay, so before we go into the topic for today, I want you to like, to share, and to subscribe, and please click on the bell so you get notification when we upload new movies. And don't forget to leave your comments. So we will be right back. Welcome back again, viewers. Welcome back. This is Afrocliq TV, and this is your girl, Mamia. Okay, so let's go right into our topic of discussion today. Having a baby is a lifetime event. It's a life-changing event. It comes with a whole lot of emotions. It comes with happiness. It comes with anxiety. It comes with all sort of mixed strong emotions. Okay, it's fine to be happy, it's fine to welcome a newborn, but when this feeling becomes so extreme, it can lead to something we call depression. So that leads us to our topic of discussion today. We're going to talk about postpartum depression. Yes, postpartum depression. And please don't let the word scare you. It's simple. It just means depression after birth. Okay, so before we go into our topic today, let's just look at some few terminologies that can help us better understand our topic for today. So from the period of pregnancy to the period to a year after childbirth is termed perinatal. Okay, perinatal meaning around the period covering your pregnancy, after 1 year, and after 1 year of childbirth. Okay, so that is perinatal. It's simple, two words coming together: peri, around, natal, birth. So perinatal. And another word we want to look at is postpartum or postnatal. Post, after, natal, birth. So postpartum or postnatal means after birth. See, it's simple. Don't let this terminology scare you. They are very simple words. Now let us talk about what depression is. What is depression? Depression is a major disorder where a person has the low mood and aversion to activities that can affect their thoughts, their behavior, their feelings, and their sense of well-being. Okay, their sense of well-being. So when a person is depressed, the person has a low mood. It can interrupt your daily activity. Okay, so yeah, that is depression. Now, what then is postpartum depression? I bet you already got the answer. So that means depression after childbirth. Okay, childbirth, depression. Simply put, it's a depression after childbirth. I know you are smart, and then you put 1 and 2 together and you got the answer. So postpartum depression is a clinical depression that can affect both sexes after childbirth. Okay, it can affect both the mother and the father, but the majority, it affects the woman. 1 out of 10 women are going to experience this kind of depression after birth. It is known that 1 out of 10 women will definitely experience this. Like I said before, it can happen to the fathers, but the percentage of a father experiencing this is very, very low, because the man doesn't have the hormones that the woman has. Okay, so now, what then is the causes of postpartum depression? Well, the causes of postpartum depression is not well understood, but evidently we see hormonal changes being a cause. We see genetic, we see behavioral changes, we see a major life events leading to the new mother experiencing postpartum depression. Some of the signs that you see is they cry a lot. They cry a lot. They cry a lot, and they are easily irritated. They feel lonely and sad. They have uncontrollable mood swings. They feel guilty, and they are anxious. Okay, and they sometimes have this fear that you're going to hurt their baby. They wonder if they can be a good mother, so they have this fear of hurting their baby. It's okay if you want to be a good mom. It's understandable if you want to be a good mom, but let us take note of those changes that we experience after birth. Okay, now I know some of you have heard of blue babies, which is postpartum blues. It is quite different from postpartum depression. Okay, it is quite different from postpartum depression, which I will explain as the teaching goes on. Now let's take a look at the causes, how the hormonal changes can lead to PPD in a woman. Okay, when a woman is pregnant, there are 2 hormones that shoots up, the estrogen and then the progesterone. So after childbirth, there could be a drastic fall of those 2 hormones that could lead to the woman or the new mother having PPD. Okay, there could be a decrease in the thyroid hormones. There could be changes in their blood pressure, in their metabolism, leading to fatigue. Those hormonal changes can cause, or it's believed that it can lead to PPD in the woman. Okay, now let's go to emotional changes, how emotional changes can make a new mother experience PPD. When you give birth, you need to take care of your baby. So especially when you are alone and there is no support, you are deprived of sleep. Now, being deprived of sleep can also lead to having PPD. If you hear me say PPD, I'm talking of postpartum depression. Okay, so deprived of sleep, you're not being able to take care of yourself. Poor self-care can lead to PPD. The fact that God has blessed you with a newborn doesn't mean you should neglect yourself. So poor self-care can also lead to the new mother experiencing PPD. The feeling of anxiety, of you wondering if you can take care of your baby and take care of yourself, can also lead to PPD. And now you feel like you've lost control of your life. like you've lost control of your life. Your life is in a different stage now. You moved from the curve, hourglass lady, to a bloated tummy. And now you have to take care of a newborn baby that is demanding a lot from you. So you feel like you have lost control of your life. That could also lead to PPD. Now, lifestyle also cause PPD, okay? Having a demanding baby, having to pay attention to both your older babies and the newborn, having to breastfeed, difficulty in breastfeeding, not having the support that you need, having financial problem can also cause the new mother to go into PPD. Now, this is where I would want to encourage families, partners, friends to be of support to new mothers. Okay, we pay so much attention on the newborn baby, which is very good, but we also need to pay attention to our mothers. Okay, we need them to be well, we need them to be whole, we need them to have a sound mind to be able to take care of the baby. So we need to support them. Now let's talk about the difference between PPB, which is postpartum blue, and postpartum depression. Okay, every woman, about 50 to 80% mothers, have experienced postpartum blues. Its onset is from the 3rd to 4th day after childbirth, going to 2 weeks. Okay, where the woman feels anxious, you are so tearful, like you wonder if you can take care of the baby, you are so overwhelmed. Okay, every woman, at least 50 to 80% of mothers have experienced baby blue. Okay, they've experienced baby blue. And with PPD, its onset is 1 year after childbirth. It can last from 2 weeks going. When it lasts for more than 2 weeks, that is when we need to pay attention to it. With PPB, it can resolve on its own. Okay, you don't need any special treatment. You just feel it for a short time and you're okay. But with PPD, it can move from moderate to severe. Okay, from moderate to severe. And we don't want it to get to the severe stage where it will take us to postpartum psychosis. That is a rare condition and it's a life-threatening condition. Okay, we'll talk about it. But with PPD, the difference between PPD and PPB, the onset, it's different. PPB is mild, okay, it goes on its own. But PPD, you need to pay attention to it. It is said that 13% of mothers will experience PPD after childbirth. They will experience postpartum depression after childbirth. Okay, and one of the ways we can prevent this is by exercising, is by talking, is by taking care of ourselves. Talk to your partner, talk to your family, talk to your friends. Who is that one person that when you call, when you talk to them, they will be there for you? Please talk to someone. Do not keep it all within you. It's overwhelming. Okay, do not keep it all within you. You need to open up. You need to share how you feel. And family members, let us help the new mother understand their emotions right now, because they don't really understand what is going on in their body. Like I said, you move from one stage of your life, from being the perfect curvy lady to a bloated tummy for 9 months with all the stress in it, and now you have to take care of a newborn baby. It's overwhelming. So family members, friends, husbands, please let us be of support to the new mothers. I know those living in abroad spend most of their times in work. You come back from work and you are tired, but please Let us find time to help the new mothers so they could also have enough rest. We don't want them to break down. We do not want them to break down. And so one of the ways we can prevent it, like I said, is by exercising, being more conscious of what you take inside, to eat healthily. Okay, eat healthily. Let your body be concerned of what is going on in your body and what is going into your body. Okay, and one of the ways that we can treat you, if you want to talk to a therapist, it is fine. They know the right questions to ask. They know the right method to help you get out of the situation. You are not alone, and so do not carry it all alone. Please talk to someone. Do not try to be a super mom. Okay, you are already doing very well. You need to give yourself some credit. Tap yourself on the shoulder, give yourself some credit. Yes, I'm doing it. I'll get there. Okay, don't carry everything. When you need help, please ask for help. Okay, please ask for help, and try to have some time for yourself. Try to have some time for yourself. Some mothers will put the newborn baby to sleep after they'll have to clean the whole house, and when they are done and it's time for them to rest, the baby is awake and there's no one there to support them. They don't have enough rest. You need to find time to rest yourself. You need to find, even if you can have a deep sleep for 30 minutes, it's fine. Okay, it's fine. Do not carry it alone, and try to do the things that you used to do before that you were happy doing it. Okay, don't stay out of touch in reality. Don't neglect the things that you used to do before. Okay, still go out. You need fresh air. Talk with friends. Do not isolate yourself. Okay, go out. Talk with friends. When PPD is not treated well, that is when it can lead to postpartum psychosis. It is life-threatening. That is when the woman begins to have suicidal thoughts. That is when the woman can harm herself and even want to harm the baby. Most mothers have killed their baby because they couldn't treat the PPD, and now they find themselves in a PPP stage, postpartum psychosis. Okay, we don't want to lose our baby. We don't want to lose our mothers. So I'm going to say this again. Friends, family, partners, please, let's be of help to them. Let's watch the way we talk to them. That is not the time to use abusive words on them. It is time, if you're a husband, it is time for you to remember your wife that, hey, she's still beautiful. She's still got the looks, She's still got what, got your attention. Let the person feel loved. Let the person feel special. Okay? Postpartum depression is serious. A lot of women are facing it, and some are keeping it to themselves. It is time to talk out. It is time to open out. No one has the right to judge you, and no one is going to judge you. So please talk, okay? Leave your comments in the comment section if you've ever experienced this before. Let us know how you overcame it. Let us know what you did to help you. It could be of help to someone else. This brings us to the end of our discussion today, guys. I hope you learned something from it, because I learned something from it. Don't forget to like, to share, to subscribe, and don't forget to leave your comments in the comments section. I can't wait to see you all next time. God bless you, be safe, and have a very, very fruitful day. Bye bye, see you soon.